All right. First, I want to welcome everyone and thank everyone for joining us in this discussion tonight. I'm Dr. Jessica Gautreaux. I'm a child neurologist in New Orleans. I specialize in headache medicine there. I'm really excited to talk about a very important topic tonight, which is how parents and guardians and caregivers and loved ones can advocate for the very special children in their life who are living with migraine disease. Tonight, we'll start with me giving some tips and my thoughts on ways that we can be better advocates for the important people in our life. And then at the end, I will try to take some questions from those of you who are joining us this evening. So thank you all for being here. I think we'll get a lot done this evening. The first thing I want to say before I start is that I know that if you're joining us tonight, you're already a wonderful advocate for your child or little one in your life. Parents are advocates every single day. They're constantly trying to do what is right for their children. But I think when it comes to some specific topics, sometimes it's nice to have some tips and some resources that can help to make you an even better advocate. So that's my goal tonight. I know that you are all doing some of these things already. I'm just wanting to provide some information that you might find useful. Um, so we will go right ahead. The very most important thing I think about being a good advocate is to know your facts. So you have to be educated about what you're going to talk about and know a lot about what you're going to be fighting for to really be able to produce change and to get the things done that you want to get done. You would be surprised that the community and the people around you may not know a lot about migraine disease. You're going to be advocating in so many different situations in your child's life. So some of the examples that I think of are schools, of course, and their extracurricular activities. Amongst your friends and family, you may have to advocate for your child who's living with migraine. Really, in your village, you may have to advocate for your child a little bit. You may even find yourself coming up against an insurance company, which can seem a little bit daunting. So, we're going to go through some of those examples. But in each one of those scenarios, you will likely have to provide the person you're speaking with or the group you're meeting with about some information about migraine. It can be surprising to those of us who kind of know migraine every single day to realize that the people around us have heard of migraine. It's so common, many people have heard of it, but they don't really know or really understand what migraine is. Many people don't understand that migraine is a disease. They don't recognize that just like children who have asthma every day, but have asthma attacks, children with migraine are very similar. They have migraine every day, and then they have attacks of these episodes of head pain and other symptoms. So you sometimes just have to educate people about the very fact that migraine is a disease. Another thing that people may not realize is that the headache that you have with migraine or the head pain you experience with migraine is not the same head pain that many people have felt just when they have the flu or maybe if they have forgotten to eat something. So sometimes you're just trying to educate people about the experience of migraine and explain to them that it is not just a headache. So I think before you can really be a strong advocate, you have to know some facts and get some background yourself. There are many, many ways that you can become more educated about the disease of migraine and learn more about the disease of migraine. So one option, of course, is to talk with your child's medical provider. So their doctors are great resources, and you can ask them questions and kind of fill in the gaps that you might have, or fill in questions that people have asked you. You can learn that by just simple discussion with your care providers. But other resources are available too, and one great one is the American Migraine Foundation's Pediatric Migraine Hub. So it was recently launched. A bunch of people came together and created a lot of resources that are very useful for parents who have children who are living with migraine disease. They have articles about situations you may face in schools. They have basic facts about migraine. You would be surprised that some people don't even realize that migraine happens in children. Some people think it's a disease that doesn't affect kids. So a lot of times you may be starting from scratch and really need to provide a lot of education about the disease. Another way that you can really be prepared from a fact standpoint is to know a lot about your own child's experience of migraine and their treatment plans and their medications. Because this will come in handy for you when you go to sit down with school to create a medication plan. If you find yourself having to fight for treatments or therapies, being with insurance, being able to say what you've tried in the past and what's worked and what hasn't worked will be very useful to you. So keeping notes and keeping documentation about your own child's specific disease of migraine is a really good way to be prepared for your audience as well. So going through a little bit more about probably 3 or 4 scenarios where I think you might find yourself having to advocate a little bit for your child who's living with migraine disease. Um, that'll be our next kind of topics. So one instance that you may not actually think about, but probably comes up a lot, is advocating for your child with migraine amongst your friends and family. So parents and kids sometimes face comments about why children who have a migraine attack might be missing an activity. So that's a great opportunity if a relative questions why your child isn't participating or isn't present for an event. You can certainly at that moment educate a little bit about the disease of migraine. And certainly as we spread awareness and educate more people, that that helps the disease and all people suffering with the disease all around us. Another place that you might have to advocate, or another thing that could come up with friends and family, is if your child follows strict healthy habits to help their migraine. For example, they drink a lot of water or they stay on a strict sleep schedule. People might question why you're doing that, or might question why your child has to carry a water bottle, or if they go to spend the night somewhere, might question why your child wants to go to bed earlier than maybe some of the other kids. So if that's the case, again, if that comment is made, that's a place where you can step in and talk to them about the disease of migraine and how these things that your child is doing helps with their overall disease state. And then again, educate them about living with migraine. Finally, I think another place is that we all have that village that helps us with our family and our friends. And so you may find yourself in a situation where you're needing to have someone care for your child while you're gone or for a weekend or during the day in the summer. There's all kinds of instances where family members and friends help take care of our children. So you may have to advocate for your child to those people by stressing how important it is that your child get their medications, for example, right when their headache starts, that they don't try other things, but follow your child's treatment plan. And again, if they don't know enough about the disease of migraine, it might be hard for them to recognize the importance of those things. So it'd be really useful for you to educate them and then really push for sticking with your child's treatment plan. And then finally, everyone has kind of comments these days, so people might even question you on why you're giving your child medications. Especially if they don't recognize that migraine is a disease, they may wonder why your child is taking these prescriptions or these medicines they've never heard of. And sometimes people don't hesitate to tell you how they feel about that. So if someone makes a comment to you about what your child is taking or what your child's treatment plan is, you can be ready to teach them and educate them about why you're following that specific treatment plan. Another place that is probably one of the most common places that we have to um, advocate for children with migraine is in schools and extracurricular activities. So here again, you have to know your audience. Teachers and principals and school nurses probably know a little bit about migraine, but they certainly don't know all that you know as someone who's living a life that is affected by the disease of migraine, and they don't know about your own child's disease of migraine. So I think, of course, you have to be prepared in this instance to certainly educate them a little bit about the disease. But also at school, there are a lot of things kind of on a checklist that you need to have done. You certainly want to make sure that your child has access to their medications at school. You want to make sure that people at school take your child seriously when they say they have a headache and need to have access to their medications. Your child may have specific accommodations for school that your pediatrician or your neurologist has recommended, and you'll need to make sure that those are being followed at the school. So you need to have a plan to make sure that all of those things happen. So my advice for schools is to start early. So it may seem like right now this isn't a pertinent topic, but it actually is the perfect time to start working on all of the things that you need to happen at school for your child. So at the end of the school year, you really need to start thinking about the next school year. So at the end of the year, it's really a good time to go in and set that appointment with your child's doctor who's taking care of their migraine disease, whether that be their pediatrician or a child neurologist or a headache specialist, and make sure that you understand the plan, that we have everything in place, and you know what the plan for the next school year will be. After that is all set in place, then you can contact the school. And it's important when the school's office, if it closes for the summer, as soon as they open back up, that you do that. And if they don't close for the summer, that you go on pretty early in the summer and let them know that you want to get everything in place for the upcoming school year. Those things might include meeting with the child's teacher. You may have to meet with the school nurse. You may even have to sometimes meet with the principal. You'll want to make sure that they're familiar with the treatment plan, that they know all of the medications that your child needs. Many schools require forms to be filled out, right, to have medicine at school and to have instructions for the medication. So you want to make sure that you allow time to be able to have those forms filled out and then get them back to the school. And then finally, if there are accommodations, you'll want to discuss that with the school. For example, if your school, if your child needs to carry a water bottle at school, or if your child needs to have a certain amount of time after they take their medication before they return to class, you want all of that to be in the child's medical plan at school. Some schools, they can do that with a conversation. Other schools are going to require letters from physicians or from the pediatrician to make all of those things happen. So once you have this discussion in the middle of summer, that will give you time to gather all of the documentation that you need to make those accommodations happen. The next thing that you really need to think about, though, is if you've done all of this work and you have all of this in place at the school, what do you do if it's not being followed? What can you do if they're not letting your child go to the office to get their medication when they say they have a headache? Or what if someone's giving your child trouble about carrying their water bottle? You may have to be ready to escalate things. So you may have to go to the principal's office. You may have to be prepared to be able to keep insisting that the medication plan that you've come up with your doctor is being followed. And again, I think one of the best ways to stress the importance of that plan is really to try to educate your audience, whether that be the school nurse, like I said, or the teacher. And sometimes this even comes up with coaches because your child may need extra water breaks during practice, or it could come up with like a club moderator. So all of those people are people that you might encounter during school and through extracurriculars that really might need some education about migraine. And then once they know more, it will be easier to advocate for your child. Um, some things that may be really pertinent to specific of school is making sure that it's taken seriously, that your child, when they say they have a headache, that they recognize that their migraine is different than other children who might say they have a headache. So it's important that they understand that your child has migraine disease, and your child may not say, I have a migraine. They may say my head hurts, but for them, that's very important. And that means that treatment plan needs to be followed. Another place that you may find yourself really having to advocate for children who have migraine is against insurance companies. And like I said earlier, that can be a little bit daunting. So when it comes to migraine therapies, insurance companies and payers tend to have a lot of different policies in place about the different medications and therapies that are available for treating migraine disease. So as you guys are probably familiar, there are oral medications, there may be cognitive behavioral therapy, there may be procedures that are being done, and some of those can be difficult to access. Most payers have certain medications that they cover, and then other medications that they don't. Many payers have stepwise policies, meaning you have to try one medication and fail it before you can move to another medication. So it is not uncommon when treating children with migraine to run into barriers sometimes to getting the medications we would like to use as physicians. So when that happens, we as physicians can certainly appeal on the behalf of your child, but sometimes that's not successful, and it's up to the individuals to work with their insurance company to try to get access to the medicines that they want their child to have. So I think that's a kind of intimidating place sometimes to have to advocate for your child. The person on the other side of the phone may know about migraine or they may not. So again, this may be an opportunity to educate about migraine disease in general. But also, this is really where that advice I was giving earlier about keeping records and knowing all the medications your child has tried, all those things that have been effective or ineffective, and all of the doctor's appointments and everything that you've done, keeping that handy and knowing that well will really be useful to you, because you'll be able to state your case and really tell them about your child's migraine disease and push why you really need to get access to this new medication because some of the other things haven't worked. Finally, there are ways to kind of go beyond just your own child's experience in advocating for migraine. So there are groups that are advocate at a national level for the disease of migraine in general. So there are groups like American Migraine Foundation that are raising awareness, like here tonight. There's the Coalition for Headache and Migraine. There's the Alliance for Headache Disorders Advocacy. And these are groups that are working at the governmental level and on a wide scale to raise awareness about migraine and try to impact change at a higher level, at the legislative level, even that can impact people who are living with migraine. So there may not specifically be a bill or something going through Congress where you hear the words migraine, but it may be a policy about prescription medications that allows that if it passes will be beneficial for people who are living with migraine disease. So these groups are out there and they're fighting to create change. And if you follow along with these groups, a lot of times you will see opportunities to be an advocate through them. So, for example, they may put out a petition to get something moving through Congress, or they may let you know that there's a bill up for vote or something that they're taking public comment on, and they may ask you to send a letter to your congressman or to your local representative. So, following along some of these groups that are advocating regularly for migraine disease in general will allow you to try to impact change on a grander scale that can really impact your child's life outside of the day to day. So getting involved in migraine advocacy can be really rewarding and really beneficial long term for your children. Um, so I think at this point, I will see if we have any questions or anything that people would like to have answered. And again, I just want to say that I think it's very pertinent to find a resource that you trust. I really think the American Migraine Foundation's Pediatric Migraine Hubs has so much useful information. Like I said, even checklists about some of the things we talked about tonight, like how to get ready for school and what kinds of things are going to be important when you get ready to go to school and create a treatment plan. So pick something that you can, rely on and go back to as a resource over and over again that can be your home base. And I think ultimately you'll feel like you're more prepared when you have to go out and advocate for your children. Again, thanks everyone for joining us this evening. I hope you found this to be a useful topic. And then again, there are several links now in the comments that might be helpful. And if you want to learn more about ways to or have more resources to help you be a better advocate for your child who's living with migraine, be sure to check out the Pediatric Migraine Content Hub. I think there's a lot of great things there. So thank you, and everybody have a good evening.